Well, welcome everybody for joining the concluding remarks from our second day of the NHF State of the Science Research Summit. My name is Mike Recht. I am the co-chair of the State of the Science Research Summit, as well as the Chief Science Officer at the American Thrombosis and Hemostasis Network, and a pediatric hematologist at Oregon Health and Science University. Next slide, please. I want to remind everybody that this program was supported by the National Heart, Lung, and Blood Institute of the National Institutes of Health, and that the content is solely the responsibility of NHF and all the speakers and does not represent the official views of the National Institute of Health. Next slide. So a reminder of NHF's mission. The National Hemophilia Foundation is dedicated to finding cures for inherited blood disorders and to addressing and preventing the complication of these disorders through research, education, and advocacy, enabling people and families to thrive. The whole idea behind this research summit came from this mission statement that NHF as an advocacy organization understands that one of the most important ways to advocate for the ultimate health of people and families affected by inherited blood disorders is through research. So next slide, please. And again, I'd like to thank all of our subject matter experts who participated throughout the process that led to this four-day meeting, to the working group co-chairs and participants who worked tirelessly to develop the research priorities, and to the planning committee, steering committee, and advisory committee members who provided all their time and effort to this project. In specific, I want to thank Michelle Whitcop and Maria Santiago from the NHF, as well as Donna D. McKelly, who worked as a consultant during this process. So thank you to everybody. Next slide. So day two, these were the two topics of conversation. We heard from working group 2, who gave us the research priorities on von Willebrand's disease, inherited platelet disorders, and other mucocutaneous inherited bleeding disorders. And then from working group 4, women and girls and persons with the potential for menstruation. Next slide. So let's start by talking about what we learned from working group 2. Next slide. So there were some significant themes that were identified throughout both the plenary talk as well as through the working group talk. And let's sort of understand what these themes were and how they might inform the research objectives that were identified. So there were really a total of 7 themes that were identified throughout the different talks earlier this morning. And the first is we need to better understand the biology of von Willebrand's disease, as well as the other mucocutaneous inherited bleeding disorders. We need to have novel therapeutics and treatment protocols for this group of inherited bleeding disorders. We need to standardize protocols for the diagnosis of the inherited platelet disorders. And what I heard loud and clear, at least, was the need for research into von Willebrand's disease and aging. Next slide. Further identified themes were the need to include hereditary hemorrhagic telangiectasia, Ehlers-Danlos syndrome, and bleeding of unknown cause into our longitudinal cohort studies. That includes biobanking. We need to have the large definitive clinical trials in these disorders with embedded diagnostic and mechanistic studies. And we need to have more research on the genotype, phenotype, proteotypes, any kind of omics or any genotype or phenotype correlations. Those studies need to be done in order for us to better understanding the bleeding that can occur with these diagnoses. Next slide. So the questions that were raised by these themes include, how are we going to get all of this funded? There were some thoughts about the potential for different fundings, but really we're going to learn more about that tomorrow. Again, as identified yesterday in both the hemophilia and ultra rare bleeding disorders working groups, we want to figure out how we're going to ensure access to appropriate diagnosis, appropriate care, and research. And then how do we elevate the profile of these inherited bleeding disorders during medical training? And by medical training, I don't just mean physicians, I mean training of all providers that touch the lives of people affected by these disorders. Next slide, please. So let's talk next about what we learned from the women and girls and persons with the potential for menstruation sessions. Next slide. So what I learned from Dr. Court's talk was that estrogen seems to be beneficial for both mice and rats and human beings, that exercise is beneficial, and that combining estrogen and exercise is extra beneficial. We need to have validated patient-centric outcomes, and an understanding of the adequate hemostatic levels across the lifespan is essential. This sort of goes back to what we were talking about with this question with von Willebrand's disease and aging. Next slide. What I also heard was the ability to quantify blood loss matters to the FDA, but it might not matter in our ability to perform quality research. I heard that joint health matters, and I heard that appropriate screening and timely referrals also matter. So if we go to the next slide, really what I heard, the various questions is, what is the lifespan role of estrogen in bleeding in women and girls and those with the potential to menstruate? Do we really need to quantify uterine blood loss in the research setting? And I think at the end of our discussion today, that we might have come to a conclusion with this question that we probably don't need to do that to perform quality research, but we need to work with the FDA and have the NHF help advocate for research in this area that doesn't require the quantifying uterine blood loss. And finally, can novel biomarkers, validated assays, and diagnostic strategies be implemented to identify women and girls and those with the potential to menstruate who may have inherited bleeding disorders? So next slide. So what's in store for tomorrow? Tomorrow's going to be really exciting. Our last two working groups will be presenting. Working group 5 was the working group on diversity, equity, and inclusion, health services research, and implementation sciences. And as long as this working group title is, they have even more content to cover. We're going to hear from Esmeralda Vasquez. Esmeralda was a member of this State of the Science Executive Committee, as well as a member of Working Group 5. And she's also a subject matter expert with rare bleeding disorder. Our plenary talk will be given by Dr. Carrie Norris, who is the Vice President of, Health, Equity, Diversity, and Inclusion at the NHF. And she will be speaking on the intersection of research, justice, and public health. In the afternoon, we will be hearing from Working Group 6, which is the working group on resources and funding, workforce and infrastructure. The subject matter expert will be Ziva Mann. Ziva is the Director of Assessment and Development at Ascent Leadership Networks and a member of NHF's Board of Directors. I absolutely loved her biography because what she wrote is she'll be speaking to the experience of living with and loving someone with a bleeding disorder. And then our plenary talk will be by Dr. Charles Bailey, who's a pediatric hematologist oncologist at the Children's Hospital of Philadelphia. He'll be speaking on learning health systems and bringing clinical care and research together through informatics. So that's it for today. I appreciate everyone who participated in the interesting discussions and gave the wonderful talks. I appreciate everybody who listened in to today's meeting, and I'm looking forward to tomorrow's session. So thank you for attending. Thanks for coming to this conclusion, And that's all we have for today. Thanks very much.